La terapia cognitivo comportamentale ha trovato largo impiego nel trattamento dell'epilessia. Abbiamo intervistato il dottor Peter Fenwick al Maudlsey Hospital di Londra. Il dottor Peter Fenwick è un famoso neuropsichiatra, autore del libro Living with Epilepsy, ovvero Vivere con l'epilessia, e di numerose altre pubblicazioni nel settore. Il dottor Peter Fenwick è interessato al miglioramento della qualità di vita globale dei pazienti epilettici e attraverso la sua esperienza clinica e le ricerche ha potuto verificare che le tecniche comportamentali lo permettono. Abbiamo selezionato una parte della lunga intervista condotta con il dottor Fenwick e potrete visionarla in questo video. Per chi fosse interessato è possibile trovare la versione integrale dell'intervista trascritta e tradotta in italiano nel sito www.iwatson.com nella sezione dedicata all'epilessia. Are CBT techniques useful in the treatment of epilepsy?
Definitely.
Yeah.
Behavioral techniques are very useful.
Okay.
And modification of patients who have epileptic seizures is important. And what you can do is, in a number of them, you can get them to reduce their seizure frequency quite significantly.
Mm-hmm.
So behavioral treatment should always be considered. In fact, I think it's very difficult to run an epilepsy clinic properly without considering the behavioral aspect, because it goes throughout the epileptic patient's life.
Yeah. Behavioral techniques are useful for all type of epilepsy.
I think that they can be used in all types of epilepsy. The best ones tend to be the focal epilepsies, but you can also use it for the generalized epilepsies. But the technique that you use for the generalized epilepsies has to be different from the one that you use for focal epilepsies.
Do you find your patients, because of epilepsy, developed panic attacks or depression, but as a consequence of having epilepsy?
Okay, there are two answers to that question. The first one is epilepsy such an unpleasant illness that it alters your relationships with people and will lead to depression or anxiety? Yes, very common. And if you have temporal lobe epilepsy, then that is a very common trigger for people. So working with them on how to cope with their feelings of depression and anxiety is quite the right way to go. The second point is, do the epileptic discharges themselves produce feelings of depression and anxiety? And the answer is yes, they do. And again, then you have to teach the patients how to cope with those, because a lot of them get very miserable after a seizure because they feel so depressed, because they feel anxious.
Tell us, what are the trigger events or trigger feelings that are more common for epilepsy? You were talking about anxiety, and then you made a list.
I think we did in fact publish this. This was a survey which I did.
Yeah. Okay.
I did it in the Maudlsey Hospital, which is a neuropsychiatric hospital. I did it in a general hospital, and I also did it with a group of people in Japan. And the questions, there were a list of questions, and the people who were asking the questions went through them, and they said, do you get seizures when you feel anxious? Do you get seizures when you feel angry? Do you get seizures when you feel depressed? And so we were able to see how commonly in these different populations of people these feelings would trigger seizures. And what was very clear in this country was that anxiety and depression were the ones that were highest up on the list. Now, what was very interesting to me is that in Japan that was not so. Anger was the one which was highest on the list. And this is purely cultural. In Japan, you can't say that you're depressed, you can't say that you're anxious, but you can say you're angry. And so I think that there is a cultural component into what we found. But at any rate, anxiety, depression, anger going down, then things like tiredness, then things like hunger, whether or not they occurred with your periods in women, so periods were another one. And then coming right down to the situation that most people got fewest seizures in, and that was when they were happy. So what physicians in your clinic should be prescribing is not an increase in drugs, but happiness.
Happiness.
And certainly I taught the doctors that worked with me to keep this fact very central when they were talking to patients. So you weren't, obviously you're a good doctor, you think about drugs, you think about any other factors that might have caused the seizures, medical factors, but you don't immediately go for those. Then you ask them about how they're getting on in life. And some of the patients who had runs of seizures, the best thing was to teach them to cope with the problems they were having. Sometimes it was with their boss, sometimes with their wife or girlfriend. Well, the thing to do is to teach them how to cope with that, and then it works well.
Now, according to you, where is going the future in the treatment of epilepsy? You have not only medical vision. No, it's understandable. But what do you see in future?
I see it this way. I see that the future of the treatment of somebody with epilepsy is whole person treatment. So you need to be a good doctor, you need to understand where seizures are coming from, you need to know your neurophysiology, so you understand how the seizures are arising, how they're spreading throughout the brain, what they're doing. You need to think in terms of whether this particular form of epilepsy is best treated with drugs, or whether epilepsy surgery is a possibility, because you can get very good results from that. And this will depend a lot on what the family want and what the patient wants. So you want to make sure that their drugs are looked after, their serum levels are right, all that sort of thing. And then the next thing that you want to do is you want to think again, the whole person, what is the person's relationship with his family, but don't forget that there is evidence from 1 or 2 papers, particularly from Finland, which show that parents of patients with epilepsy, children with epilepsy, are more likely to commit suicide than those who don't. So having an epileptic child is very stressful for the parents, so you want to put in place support for the parents as well as for the child. Then the tuition of the school, their friends and so on that we've talked about is very important. Are there going to be non-drug treatments? Well, yes, probably in some people. And I think some biofeedback, certainly for 1 or 2 people who we've tried it on, got to the point where their seizures stopped. Now, they were all on anticonvulsants, fine. So they're now on anticonvulsants seizure-free. So do you then finally go through the normal process of reducing their drugs? And the answer to that is yes. And it may be that there will be a group of patients who you can continue with biofeedback and they will finally come off drugs and remain seizure-free. So I think the proper treatment of epilepsy is whole person treatment. So you treat the medical condition, you treat the social condition, and most important, you treat the psychological well-being of the patient himself.